Hello, my name is Anais Loisian. I think we're going to get started today. Good morning and good afternoon to all of you joining us. So I'll be moderating our session today, and I'm pleased to welcome you to our first Early Childhood Workforce Initiative webinar. For your information, this event will be recorded today and rebroadcast at a later date. You will be able to on a Facebook page. We'll let you know the information at the end of this session. Without further ado, let us begin now with an introduction from Ms. Mihaela Ionescu, who is the Program Director of the International Step-by-Step Association, or ISSA, based in the Netherlands.
Good morning, everybody. Good afternoon, and a warm welcome from our end to the International Step-by-Step Association. I will just say a few words as an introduction. This initiative has been started together in partnership with our colleagues from Results from Development Institute in Washington. And as it is a global initiative, we aim to join our forces together with all practitioners, experts from all over the world to fight for the status of the profession of early childhood practitioner. The initiative has a holistic and multi-sectoral approach and aims to bridge the gaps in policies and practice and to promote the high quality and equitable services. As you could see on the screen, the four thematic areas that are in focus in this initiative are around the competencies and standards, training and professional development, monitoring and mentoring, and the recognition of the profession. As a global initiative, in order to engage with actors from different countries, we will have two functions. One would be of creating and sharing knowledge around the four areas, and the other one would be of facilitating a joint learning. Of course, that the venue for both functions will be the online portal that you can see now on your web screen, and where you could find information about all of the sections that are referring to either the knowledge hub, either the joint learning activities. This webinar actually is the first activity that we are launching within the joint learning function of the initiative. The Knowledge Hub, it's the place where you will find, and we encourage everybody to contribute to it, resources around the four thematic areas that you will be able to filter, to find from different parts of the world, different resources, either research studies, either policy documents, either tools that can be used by practitioners or other actors in the early childhood education and development systems. We hope it's going to be inspiring for everybody. We hope that it will create a movement and will engage a lot of actors from the country level towards changes that are absolutely needed for putting the early childhood profession in the focus. I think that this first webinar will be one in a long series, and we will look forward to putting interesting topics around the four themes, and to have interesting speakers and to learn a lot about what happens in different countries around the world, and to share, impart our knowledge that we have learned through the landscape analysis that will be done through the initiatives, to the country studies that we plan to do within the initiatives, through the web portal that is ready for you to navigate. I hope this was enough information. I just would like to welcome all our participants and panelists to the discussion around diversity and identity in the early childhood profession. Thank you, Anais.
Thank you, Mihaela. Today's webinar is entitled Diversity and Identity, the Early Childhood Workforce. Research and experience emphasize the importance of a high-quality workforce and an enabling environment to support and encourage all developmental opportunities of young children during this early childhood period, which we define as from birth through to the early school years. Providing a supportive working environment and sustaining workforce motivation are factors which we all know help these workers strengthen their capacity to provide children with a safe, healthy, stimulating, and caring environment. So as policymakers, practitioners, advocates, and researchers, we are a broad audience today, we also understand that the identity of this workforce is critical to providing a coherent approach to early childhood development and learning. Providing children and their family with support and services they need should be based on a common fundamental understanding and knowledge about how the child develops and learns, about the values to facilitate their healthy development and learning, and about a coherent and integrated set of approaches and services. Yet we also know that the challenges that come with having a very diverse ECD workforce are numerous. There are many sectors involved in providing services to children and their families: health, nutrition, education and care, social protection and welfare. So during today's webinar, we want to reflect upon how we can build upon the strength of this diversity. Diversity in terms of identities, experience, qualifications and background, diversity in terms of their experience, skills, capacities and competencies. And we have a great set of panelists today. So before we begin, I want to spend just a few seconds on the structure of today's webinar. We will begin with presentations from our 4 panelists. And then we will continue with a 20-minute discussion session during which I invite all participants to ask questions using the chat function at the bottom of your screen. You can write in your questions and requests, I'll collect them, and I'll read them as we reach the discussion session. Please thank you for keeping any clarification questions, and at that point we can use those as well. If you're a person who's tweeting this event, we ask that you please use the hashtag that we've developed, which is capital ECWEB1. So it's hashtag ECWEB1, and we thank you in advance for that. And let me also remind you before we continue that we will have another panel tomorrow. It's the same topic, but we will have different panelists, and if you're able to join us, it will be at 5 p.m. at Netherlands time tomorrow, Wednesday, July 13th. So now we have 4 panelists today whom I'll briefly introduce before they do their respective presentations. You'll also find a short bio and the links provided in the email invitation you received. We begin today with a joint presentation from Lydia Foong, who's head of the Faculty of Education, and Professor Mogana Dhamotharan, Professor of Education, both from SEGi, University in Malaysia. Ms. Foong has been involved in early child care and education for over 23 years in both Malaysia and the UK, and together with Professor Damansara, they will present findings from their recent study on the work conditions of the early childhood care and education workforce in the private sector in Malaysia. So without further ado, I'll leave the floor to you, and thank you both for joining us today.
Thank you, Ade.
That's great. Thank you.
Hi, I'm Lydia Foong. Malaysia, ECC in Malaysia has a diverse landscape with public, private, and NGO participation and about 70 years of history. As you can see from the screen, the early childhood care and education context in Malaysia is divided into 2 groups. The first one is child care, which is from birth to 4 years, in the preschool sector, which is 5 to 6 years. They are managed by different ministries, which is the Ministry of Women, Family and Community Development and Ministry of Education, respectively. We have set a national key result target agenda, which is to increase the enrollment of childcare and preschool. For childcare, we would like to raise it to 25% by 2020 and 97% by 2020 for preschool enrollment. In terms of the workforce, as in the teacher's minimum qualification, at the moment the childcare providers or the educators are required to attend a Pramata childcare course, which is a basic certificate program. And for preschool teachers, we are looking towards a diploma in early childhood education by 2020. But the expectation for both the public and private sectors are different. In terms of the public sector, they are required to already hold a diploma in early childhood, and many of them already have bachelor's degree in early child education. For the private sector, at the moment, it's only at O-level qualification and moving towards diploma in early childhood by 2020. We have our government who place emphasis on early childhood education and offer free places for young children with qualified staff in the public sector. Our national curriculum and program standards for teacher training and for the programs for young children are established. But at this point in time, we are at the crossroad to reconceptualize professional identity of the workforce, namely the work itself, the work conditions, as well as opportunities for career progression. Professor Mogana and I and another colleague, Dr. Palani, had conducted a study in 2011 to explore the work conditions of the ECC workforce in the private sector related to the qualifications, work conditions, and the readiness for professional development. The data was collected through a questionnaire survey. A total of 3,087 participants responded. And the results, I would just want to share the summary of the key findings. Majority of the private sector early childhood workforce in Malaysia is relatively young. 67% of them aged below 35 years old. They are underpaid, where 70% of them earn below 900 per month. Why we set it at 900 was because 900 is the minimum wage for Malaysian labor force. They are overworked in terms of the salary that they receive. They work an average of 35 hours per week. And just as in many countries, 99% of the workforce is female. 43% of the educators have less than 2 years of teaching experience. The results suggest that there is a high turnover of staff, or there is new centers. Although 18% of them have over 10 years of teaching experience at the ECC settings. The majority of the workforce during the time of the survey were aware and in favor of the ministry's intention to introduce diploma as a minimum qualification, and were keen to further their studies up to diploma level. But about a quarter of them who are interested were already doing so, but the rest of them indicated that they were not pursuing any further studies for reasons such as financial and family constraints. Therefore, some form of financial support or scholarships are needed. Younger teachers in the 20 to 25 age group wanted to further their studies. Our cross-tab results show that as teachers grow older, when they receive higher salary and when the number of children in the family increases, the intention to pursue further education declines. The teachers' intention to pursue further studies increases until certificate level, after which it declines. Because at this point in time, we have not introduced minimum qualification at the diploma level for the private workforce. But interestingly, in terms of teachers' intention to pursue further studies increases during the first 2 years of working life. Their intention to pursue further studies show a decline from the 3rd to the 5th year of service. But after which, their intention declines when they reach about 5 to 10 years of experience. So I will invite Professor Mogana to share the implications of the study to the audience.
Thank you, Lydia, and a very good morning and good evening to people, whoever all around the world listening in to us this afternoon. This evening for us, actually, it's about 4:20 here. This is a very interesting topic that we are on, and I think what has happened is there have been so many implications. I mean, even our study has shown that there has to be adequate pathways or support and flexible pathways for in-service teachers in further education, and this includes pre-service, preschool educators. It is because they have to either return to the conventional sort of setup that causes the difficulty for many teachers to take time out, or they have to sort of think in terms of how are they going to fund their own education. So I think that is where these are the shortcomings, or some of the things that we have a kind of probably seriously have to look into to further sort of professionalize early childhood education. Because I suppose historically, let's put it this way, or even in terms of education, preschool education was never had a sort of a significant sort of importance. It was early years, that means primary school, and then secondary school, on to tertiary education, and then further education from the university education. And very mistakenly, I suppose, downplaying the importance of preschool education. And now there is a certain realization towards that sort of end, and I think we're working towards that seriously in most countries. And some countries have moved further than others, and others have a longer way to catch up. But I think the other good thing, or the positive thing, is also the emerging policies on teacher qualifications. Because as of now, we have approved the diploma, a basic qualification for all preschool educators. But we are still, this will be coming into full effect by 2020 in Malaysia. And the other thing that concerns us very much is also is how do we expand the professional development and further education programs for the early school, preschool teacher educators, preschool educators and preschool teachers. So this is why we started by saying that we need to look at more supportive and more flexible pathways. And again, coming back to the other main issue is the pedagogy and the early childhood philosophy, and how do we mentor. We need the new teachers to be mentored so that they stay longer, because we've also found there's a greater tendency for teachers to stay longer in the public sector, because as we know, we have this divide in Malaysia. We have the public sector as well as the private sector providers. So the public sector providers, the teachers who go in there seem to carry on longer, whereas there's a huge turnover or faster turnover in the private sector. So to attract them and to keep them going is another big issue, so that there is undisrupted continuation of what should be happening at these centers or at these preschools. Therefore, it becomes a little difficult for talent recruitment and staff retention, particularly in the private sector. And I think this has become another big concern for the private sector. So what we are saying is, at the end of the day, is where is the advocacy coming from? Who is going to be advocating for this workforce? So I think it has got to go back to policy, it's got to go back to government, it's got to go back to community, it's got to go back to families, and it's got to go back to individuals who would like to go into this profession, so that they consider this as a profession, they take it seriously, and they move and evolve in their own way, as all other professions have evolved, to make a stand and to sort of highlight the importance of early childhood education, and give it that sort of what I would call dignity and a place in the whole big picture of education. So I don't know whether we have gone beyond time, but we have, I think, to say this afternoon, and we'd like to pass it over to Ines. And thank you very much for this opportunity. Thank you.
Thank you. And you do have a little bit more time if you'd like, but we can also use that time during discussion period when we all discuss. But our next panelist is Professor Hiro Yoshikawa, who is the Courtney Sale Ross Professor of Globalization and Education and University Professor at New York University Steinhardt School of Culture, Education, and Human Development in New York City. He's also co-director of the Global Ties for Children, which is Transforming Intervention Effectiveness and Scale Center at NYU. He's going to present his latest research today on the ECD workforce, which includes findings on how to improve the quality of caregiving while at the same time improving child development outcomes. Thank you for joining us today.
Sure. Thank you very much for the invitation. I'll be on this very first webinar of a very exciting new initiative on this very critical issue of the ECD workforce. So I was going to talk a little bit about the different levels of the workforce in any national system, from the frontline caregivers, health workers, and teachers, to their supervisors and inspectors, to kind of administrative and subnational and national leadership, just to lay out a little bit of the picture of this and give a few summary updates around the research, what the current research tells us about how to support these workforces, particularly in the pre-service, in the in-service phase. So after these folks have already started working. So, but before I go into that, I want to say something based on the excellent Malaysia presentation, because one of our projects at our Global Ties for Children Center is on preschool teacher professional development in Ghana, in peri-urban areas of Ghana, which are the kind of informal settlements outside large cities that are increasingly cropping up around large cities worldwide. And certainly this is an issue in Ghana. And just because I think some of our new data, this is a study of roughly 250 or so preschools across public and private sectors in Ghana, in areas where there are options for both. And our data are currently showing that teachers in private schools are younger, less educated, and less likely to have training in ECD than the government preschool teachers. On the other hand, the private preschool teachers are reporting higher levels of motivation in their teaching than public preschool teachers, which is kind of interesting. We have also gone in and looked at the observed quality of classrooms across these private and public settings, and interestingly, the private schools show a bit higher emotional support and levels of behavior management, but otherwise for issues of supporting student expression and instructional quality, there are a few differences. So that's just to give a little bit of a sense of our current study, very new data from Ghana, that some of which I think support some of the points from the Malaysian study. So I wanted to talk mainly about kind of two approaches to supporting, particularly in-service approaches to supporting the workforce. The first is to really build motivation and adult learning, whether these are caregivers, home visitors, community health workers, or teachers. And the last 10 or 15 years of research are showing the promise of mentoring and coaching that is based on on-site observation. This is the kind of mentoring that is a little bit different perhaps from what we often see, which is supervision based on a monitoring checklist. If there were anything that we could say is the most common approach, particularly in low-income country contexts for monitoring quality, these are checklists that largely focus on structural quality. So these are things like basic health, hygiene, and safety standards, the water and sanitation, whether there are hazards around the facility, the general qualifications of teachers, the conditions within the classroom. In contrast, mentoring and coaching tends to also include support for what we call process quality, or the quality of interactions between teachers and students, between caregivers and children, between home visitors and parents, for example. And so this kind of coaching, the key point is that there's supportive feedback and mutual rapport between the mentor and the frontline worker. And so rigorous experimental evaluations in Pakistan, in Chile, in Colombia, the United States, and elsewhere are showing that that approach can improve the quality of interactions between caregivers and children, the quality of interactions between teachers and students, the quality of interactions between home visitors and parents, for example. And this evidence, I think, is starting to be picked up by certainly professional associations like the International Step-by-Step Association, some current efforts by the Colombian government, for example, to try to transform the role of inspectors and supervisors so that they become more like mentors and coaches. So that's a very promising development, I think, in workforce support. Another one is how to support networks of professionals in these workforces. And there is an approach, for example, called continuous quality improvement that brings together networks of frontline caregivers, teachers, even parents with their supervisors, the inspectors, and even subnational or regional staff and administrators to engage in joint learning sessions where the entire group sets common goals for how to improve quality, for the kinds of practices they would like to work on, translate those goals into actions, and then track improvements in their practice on a daily or weekly basis. And then that one together periodically, often every 3 to 6 months, to share strategies that worked, strategies that and barriers that might have been challenges. So in the country of Chile, we conducted the first impact evaluation of whether this approach to continuous quality improvement can actually improve child outcomes, not just the skills of the workforce. And we did in fact find increases in young children's vocabulary as a result of this network-based approach to continuous quality improvement. So I think there's a lot of promise here in bringing networks together, having them engage in this kind of rapid cycle, plan, study, and act cycles in real time for quality improvement. And a side product of this kind of effort has been that all members of these networks feel much more supported. And I think we need to acknowledge that the early childhood workforce is not just often inadequately compensated, but also quite isolated. Whether they're in a school context or just simply working alone in a community-based preschool context. And of course, home visitors are also quite isolated in their work. So this network-based approach is a very important way to build motivation, set common goals, and improve quality. The last point I wanted to make is that we should consider the higher levels of administration in the national ECD system as important parts of the workforce. And we should think about governance and finance in workforce development. So I think there are a few efforts in certain countries to define the competencies, for example, of subnational leadership. That's at the province or region or state level. What are the competencies that might be required for those working in ECD, in social protection, in health, in education or child protection? And then how do we support those workforces? How do we support the middle level leadership in a national ED system? They also need to learn from a very much on-the-ground basis what process quality and good practice means, but they're responsible for large systems, and I think we need to do a lot more to bring those networks together to share strategies, to study what is most effective in supporting that workforce, and then understanding how the financing of those supports works. So I should probably stop there. I might have gone over my time, and look forward to the rest of the conversation.
Thank you very much, Hiro. Those are very interesting projects that you're working on, and we all look forward to hearing more about them and during the discussion period. I'm also going to present our fourth and last panelist today, who is Lynette Okengo, who is based in Nairobi and is the Executive Director of the African Early Childhood Network, which was created at the end of 2012. Her presentation today will focus on experiences working in a diverse set of countries and environments, and the opportunities and challenges in building the capacity of the ECD workforce in a weak early childhood enabling environment. And Lynette, thank you very much for joining us today.
Thank you. This is a very good opportunity that I'm very appreciative of, the first webinar of an initiative that addresses the heart of ECD programming. I'm really very excited about this, and thank you very much for inviting me to participate. As the previous speakers have said, it's a well-known fact that the adult in the child's life plays a critical role in shaping not only their development but also their future. So focusing and investing in this adult is a critical thing that must be done for all of us who are interested in improved child outcomes. I just would like to add my voice to what Professor Hiro said about who is included in the workforce. Children find themselves in multiple settings, at home, in an ECD center, in a health care center, and etc. So the workforce really includes the adult in the home, who could be the parent, the grandparent, a hired caregiver. It could be the teacher in the ECD center. It could be the home visitor or community health worker, the health service provider, or even a social worker. But these are just one group of service providers. We also should include in the ECD workforce other professionals who play a critical role in shaping the child's life, including the parent educators, the ECD program planners and officers in various organizations, as well as decision makers at all levels of government. Understanding their capacities and knowing what program to target to strengthen their role in whatever field they're in is critical. All these are an ECD workforce. It's not just the teacher in an early learning center. It's all these professionals. So when we reflect upon these different groups of individuals or categories, some issues arise. Who is it who is primarily responsible for making policies? What is their capacity? What is their connection with the issues that affect the children on a regular basis? How does this information feed up to them so that they're then able to implement, to design policies that will speak to the issues that are critical in strengthening our workforce? Who is the target for parent education programs? Is it parents who rarely spend time with their children? The adult in the home in many African countries, in the urban areas, would be a hired caretaker in an urban area who is often young, who doesn't stay for very long. Or in the rural areas, it could be grandparents, especially in areas with a high HIV prevalence. Who is the caretaker? Who is the parent? Who then should the parent education programs target? The ECD teacher in an early learning center, as has been said very well in the Malaysian presentation, would mostly be females. In community-based ECD centers, it would be older women, and often with very low literacy levels. And so the question of training, continuous staff development, professionalizing the workforce, all these issues become important when we're looking at how to systematize and strengthen the training program. In many urban areas, we have found in a study, for instance, that we did in Kenya in an informal settlement, that the community health worker or the home visitor is mostly a young woman who often is not a parent. And so it raises the issue of their ability to connect and communicate, particularly where they're dealing with grandparents or people with more experience in terms of child rearing. How do they connect and build upon existing good practices. So all these professionals, it is important to understand what are their capacities, where are their gaps about the training program. The effectiveness of the ECD workforce as they engage with children is to a large extent determined by their ability to engage in a reflective, respective, and responsive manner, not once but over a long period of time. These key things must be developed. And it's not only a result of their qualifications. It's not an ECD teacher's qualification, for example, that will enable them to engage reflectively, respectfully, and responsively. It's also their knowledge, their competence, but very, very importantly, their motivation and satisfaction with the job that they have. We know from research in other fields, and now more and more from the early childhood field, and as Professor Hiro has said, it matters a lot whether this ECD professional is connected to a network of other people in a similar situation with whom they can share, with whom they can learn from. It matters whether the ECD professional is trained or not, what type of training they have undergone, how long it was, what was the content, what was the focus. Was it more about acquisition of knowledge, or was it more about skills? Was it practical? Was it based on actual interaction with children? It also matters whether they are well compensated or not. The same study that was conducted in Nairobi informal settlements showed that 95% of the ECD caregivers in home-based programs would leave their jobs if they found another employment opportunity that paid them more. Often across the region, they are paid in kind, they are paid t-shirts, a little food here or there, and often it has been said that many of these ECD service providers, particularly in home-based programs, are satisfied providing a service to the children. It is not true that teachers or these caregivers will stick to the job for the love of children. They have often said to us, this does not put food on their tables. So if they found something that would put food on their tables, they would quickly abandon the job. So again, the issue that was raised by the Malaysian team about the high turnover sets in because they're always looking for opportunities. It also matters whether they're happy and satisfied. The same study found that most women who were involved in providing care services did that primarily when their children were younger because they wanted to attend with their children. And many said that they would switch jobs as soon as their children grew. It also matters whether they're connected to others who support and motivate them. It also matters what their work environment is like, whether they receive a paid leave, are able to access loan facilities, or can benefit from paid professional development programs. Oftentimes, they have to pay for their own studies, they have to pay for their own attendance to many programs. So in order, therefore, to support an effective and efficient workforce, it is critical that we advocate and that governments invest in these different aspects because they have been found to make a difference. There is therefore a need for policies that address the issues or the issue of teacher qualifications. A number of countries across the sub-Saharan Africa region do not have a policies that define the minimum requirements. And quite frankly, if they did that, we would knock out a huge proportion of service providers because they do not meet the minimum requirements. We also need policies that guide the licensing of ECD service providers. There's need for policies that address the compensation of teachers, provides for their maternity leave, paid sick days. The same study that was carried out in Nairobi found that a teacher who is on maternity leave will have to forgo her pay. So the issue of looking for a job that allows them a paid maternity leave comes in. Who pays for their professional staff development? So in closing, I'll just highlight the key challenges that we have found as we have interacted with service providers and various ECD professionals. One, capacity building for the ECD workforce. It has historically been dominated by non-governmental organizations. And as a result, these trainings are often ad hoc, they're dependent on donor funding, and skill. The focus has often been on training a little here, training a little there, but very little advocacy in terms of the work environment. Where there are institutionalized programs, for example, in South Africa, Lesotho, Kenya, Tanzania, Zimbabwe, a number of countries are now coming up with programs either in teacher colleges or in institutions of higher learning. The minimum requirement, as I said earlier, keeps out the vast majority of the existing service providers. An interesting thing that is now coming up is the fact that despite the fact that Africa's working age population is growing at a rapid pace, with young people making up nearly 40% of the working age population, there is a general disinterest in being involved in ECD service provision, especially in ECD centers. And this has been an issue, for example, in Namibia, that they're trying to advocate so that many young people are interested in joining institutions of higher learning to be trained as ECD service providers, for example, in early learning centers. The greatest challenge, however, being that after the training, most times they are not assured of employment. The low profile of ECD also continues to demotivate competent young individuals. So I'd like to close by saying that it is critical that we advocate for professionalizing the ECD workforce. But then again, we have to look at the context. What are the literacy levels? Is it possible to professionalize with the situation as it is? What needs to be done? What are the basic minimums that need to be done to get us onto the road of professionalizing the ECD workforce? The issue of lack of employment opportunities, and then generally the issue of the low profile. I think I'll stop there and say that this really is an issue that requires a lot of advocacy across the region and partnership across the sectors and coherence, especially because if we're targeting the families, oftentimes we'll hear that the caregivers say in the homes that there are too many different people coming to work with us to improve child outcomes. So there's also definitely a need for strengthening the curriculum, the training, so that there is a more coordinated approach to interacting with the families and the children in their homes. Thank you very much.
Thank you very much, Lynette, for that interesting presentation with many questions, many very important questions that we're hearing today. I'm going to start the discussion session now, and we have two clarification questions that have come up from the, and I'm putting up on the screen, from the participants, and please look at your GoToWebinar platform. You can see there's a chat box and a questions box where you can add questions, and I'll make sure we see those. So right now, let's go to the questions from participants. We have two clarification questions. Let's first start with the one for Malaysian presenters. This is from Anupra Oker, and she's asking, is the survey on preschool teachers only? And if yes, is there any information about the caregivers' capacity development for age birth to age 4 group? Thank you.
The survey was conducted for both preschool teachers as well as childcare providers as well. Yeah.
And the question is for birth for.
Yeah. Yeah, thank you. The survey was done for both the childcare providers as well as the preschool teachers.
And the question was, is there any specific information about the capacity development for 0 to 4? That's the lower age group.
Okay. Since 1984, there was a Child Care Centres Act. So there are home-based as well as institutional-based child care centres, and there are planned training which has been conducted by the NGOs in collaboration with the Ministry of Women, specifically under the Social Welfare Department, that offers the basic child care program for the childcare providers who wish to be registered as a childcare provider in Malaysia. So that was since 1984. So now it has been upgraded to slightly longer program, but it's still at a certificate level. It's called the Permata Childcare Program. Yeah. So that is for the birth age to 4-year-olds.
Okay, thank you for that.
Yeah. I hope I've answered the question. Yeah.
Feel free to elaborate if you feel the need, if you have more information you'd like to share. This is a great opportunity to speak about that younger age group that is often not discussed in the same way as the educators, the older age group educators.
Right. As I've shared earlier, the child care sector since 1984 has established the Child Care Centres Act. We have, of course, the enrollment rate at the child care centers are still at around 4 to 5%. When the national survey was conducted, it was around 4%. Of course, the Malaysian government wished to increase the level of the enrollment to about 25%. The similar mandate for childcare enrollment rate. So you'll be wondering who look after the children. For the younger children, traditionally, family members and those who are working as home-based nannies, or some may refer it to, we refer it to babysitters at home. So most of the time, parents would send them to the home-based centers actually. But of course the child care centers are the institutional-based ones where they offer of course more holistic sort of programs where they would have activities for the cognitive development, for social, taking care of the physical needs of the young children. Yeah, but yeah, there was a trend earlier about 5 years ago, up to 5 years ago, where we used to hire domestic staff to look after the children and do housework. It was not ideal, but economically it was very viable for many families. But because we have financial constraints of bringing in domestic helpers at the moment, so we are at a point where we are seriously looking at improving the qualities at the childcare centers so that parents will have no hesitancy of sending children to childcare centers and not worry about health issues or safety protection issues and so on. So the Child Care Association is working very closely with the government to improve the standards of childcare in Malaysia. Yeah.
Thank you for that.
Thank you.
That's great. That's very good clarification. There's also a clarification for Hiro about the points, the 3 different points that you made in your presentation. And they would like, is again from Nurpur, who would like to know if you could elaborate on the measures and competencies that you use to evaluate the quality of the interaction between children and caregivers.
Sure.
Okay.
So, can you hear me?
Yes, I couldn't hear you for a second. Thank you.
Yeah. Yeah. So, I think, like Anais, what you've noted, which is there's been historically more attention to the 3 to 6-year-old age range as far as teacher competencies And certainly there has been quite a lot of measurement of those in the research literature. Some of that, I think, is starting to inform professional development kinds of interventions. We have some also for more informal family-based services, for community-based services in childcare, family childcare in particular, but I think we need many more measures. There are very, very few assessments of those. Raquel Bernal in Colombia has done some of that to assess the quality of the Hogares Comunitarios program, which is group-based care of typically 10 to 12 mother-child dyads in groups with a community mother leading. And so there have been some assessments of the quality of interactions there. We're currently working further to develop some new assessments of the quality of caregiving in that project. I think there are developments in creating assessments for the two major, most commonly used home visiting parenting programs, the program based on the Jamaican model, as well as the Care for Child Development. In a variety of places, researchers are trying to develop good assessments of the quality of interactions between both the community health worker or home visitor and the parent, and then the parent and the child. So there's a lot of activity going on right now around developing those assessments. We don't have one or two what we would say are best assessments. I don't think we're ever going to get there because there's way too much cultural variation. But what is positive is that there's a lot of work among researchers working with implementing organizations around trying to create some of these measures. It's a great question. And hi, Nurper.
Hi, thank you for that. Unfortunately, we don't have the opportunity to have the discussion with the different audience speaking, so you'll be able to continue that conversation another time, but I'm sure Nurper can hear you. So we also have another specific question for Lynette to move a little bit around from Nurper, and we will get to the other questions. We still have some time. I'm highlighting the questions as you can see them on your screen. So Lynette, Nurper says that she likes this idea you have of professionalization. This is a disadvantage of speaking too quickly, is that you sometimes trip on long words. Low literacy is a barrier, but it's not too difficult to overcome. Competencies for each level of child care providers need to be identified as first stage for professionalization. Hiro did talk about it. Certification and accreditation systems need to be initiated as soon as possible. But she wants to thank you for your frank analysis. I don't know if you have any comments to add to that and exchanging with Hiro, and feel free to speak together as well. Lynette?
Hi, sorry, I was trying to get unmuted. Thank you, Nupa. Quite right. And a few countries across the region are trying to get around it. It's an issue of how do we tailor the training programs to suit the existing level of the existing literacy level, and a few countries are trying to raise the minimum entry requirements gradually. So it isn't phasing out a whole group of people suddenly, but recognizing the starting point is a little further off than we would like, but then slowly bridging it and getting it to the point where it will be easy for us to professionalize it and raise the standard of training. So yes, it's not a challenge that cannot be overcome. Thank you very much, and hi, Nopa.
that I think there have been approaches that are almost like ladders with multiple stages. One of the, I think, weaknesses of a approach to qualifications that is based on the achievement of certificates or degrees or program completion that takes quite a while to do is that can be either represent a barrier to those who have relatively low levels of literacy and education, or represent this, even for those who do, a barrier because it takes so long to get to the next level of qualifications. So I think the creative broken down into small steps, and no matter what level you're coming in with in terms of skills or literacy or background in ECD, that you are, there's a sense of steps, small steps in improving your training, breaking down programs into modules or certificates, and then again in-service training, which doesn't really, I think, providing supportive mentorship doesn't necessarily require that you are teaching that teacher basic education. It's about improving their practice. So I think those are some of the principles that emerge from creative approaches to this kind of professional development.
Thank you for that, Hiro. Let's move to the next question also, which is thanking the Malaysian presenters. And I'm trying to learn how to do this so that it looks neat for you guys as well. So I'm highlighting the questions as we speak. So the question is, I understand with the work from ASEAN, this is from Sandipan Paul, that Malaysia has been developing ECD quality standards for preschool and daycare workers, and ASEAN regional quality standards are being developed. It would be interesting to know if these standards also address teacher development and training, and what are some of the indicators for teacher development and training, and how well are these implemented? And if you have any less
for the question, Paul. Yes, we have developed the curriculum standards, quality standards for preschool and childcare. The Asian one, it is under being developed, but I think it's not been implemented yet. But both of the curriculum standards have been implemented, the preschool since 2010, and the child care is actually a curriculum guideline, which we call the Pramata curriculum, which is implemented, and both of them have their instrument for assessment for quality, which has been just launched last year specifically, on both the sectors. Yeah, we have gone through a few rounds of assessment on the ground at the pilot level, and teachers are trained. We have done some roadshows to train the teachers, working with the ECC Council, which is an NGO, to launch the teacher training program on the standards. So I suppose that is how we address the issue of teacher development and training, only on the standards. But on the other hand, we also have the program standards for the colleges and universities offering the diploma or bachelor program up to PhD level, the program standards on early child education. So that would set minimum standards for colleges and universities who offer the teacher training programs. I'm not sure if that answers the question. So we have learned that from these program standards, obviously it offers a very clear guideline to the teachers as well as teacher trainers, knowing where we are going forward. But these are rather basic guidelines. Obviously, a lot of practices on the ground need to be monitored very regularly, and of course a lot of professional development programs have to be happening at the same time as well. Yeah.
And also to add to that, Paul, we also have now in progress a big project which is actually nationwide by the NCDRC, and there are other universities, and one of the universities, SEGi University as well, participating in it. That's looking at going towards quality preschool education. That involves right from all the age groups right up to the time they go transition, because that's also become a big issue. Because why is it that children who transit from preschools into primary schools are not happy, not very happy? They find it so difficult. They do more interesting things in the preschool, and suddenly they're stuck with a very curriculum kind of approach in the primary school. So that too is now underway, and we hope to come up with a report in by 2018. So that would again be quite a revelation as to what is happening up and down the country in Malaysia. Thank you. I think that's about all that we got to add to your concern here.
Great, thank you for that clarification and interesting future development. We're, just for everybody's knowledge, we're a few minutes over time. We're going to continue discussion. We have 2 more questions. Feel free to add any more questions, and we'll go a little bit over time. And thank you for your participation again today. So this question is from Sharana. Why is childcare so neglected, particularly in developing countries, and how can it move forward aggressively? And I'll let whoever wants to take on that big question first.
I think, can I just, make my comments here very quickly, Ines? That is, I think it's got to do primarily with, the many parts of the world cultural, because with now gradual disappearance of the joint family, we're going more nucleated. Therefore, I think now there is a greater consciousness towards moving towards having institutional support and centers to cater to early child the care that is required. So I suppose maybe this is one sector that was sorely overlooked. So I think there is a move towards this, and again, as we said, it's the advocacy that's going to help. We have to strongly advocate for this, because as more and more mothers are going to work, then with the sort of the other problems that was raised, I think, by Lynette with the salaries, and I think Hiro raised it as well, and I think Lydia raised it as well. Our own study found that, saying that they find it very difficult to get help to stay home and look after their babies. So therefore, this is now moving towards other types of early child care, and these early child care will then have to go towards to professionalize and to get them institutionalized, so that in that sense that there will be better professional care provided. Thank you.
Lynette, do you want to take this on, or Hiro, would you like to make some comments? I don't know if you agree.
I think that was an excellent point about the changes in family structure and the nature of paid work. And I think this is a complex combination of how the demand for out-of-home childcare increases with changes in family structure, changes in the availability of family members. Then I think the challenges are the expense of actually putting infants together in groups to be cared. Of course, there are many community-based models to do that. And then I think the alternative, which is there are, or supplemental approach to that, which are these kinds of parenting programs. So we need to think across the diversity of what can help families. So, and I think we should not leave out social protection, because providing economic security for families provides the flexibility to spend that money to either replace wages, to reduce work effort, to spend more time with children, or to purchase childcare that is out-of-home childcare. So it's a very complicated question. I don't think there's an easy answer, but all of those forces intersect then with public or private ability to provide the childcare that is in demand.
Thank you, Hiro. Lynette, do you have any extra comments on this point?
I think I just want to agree with what has already been said, and to add that historically, early childhood services have been provided by non-state actors. They cover a wider range of children, wider portions of the population.
Lynette, we don't hear you, I don't think, anymore. I don't know if anyone else hears Lynette. I do not.
No, we don't get her either, Nels.
Yeah, I don't hear her either.
They reach the marginalized areas, and so if they were to work closer together across voice acting,
Lynette, I'm sorry. It seems like we're having some technological difficulties in hearing you. Yes, Lynette? I don't think we hear Lynette. That's unfortunate.
Okay, is it better now?
Much better. Yes, thank you. I'm sorry, we lost you for the past 2 minutes or so.
No, I was just... Okay. I was just emphasizing the important role that civil society organizations play in raising the quality, raising awareness, calling upon governments to provide programs, to allocate funding. Like Professor
I'm sorry, Lynette, it seems like we're going to have to...
a problem, it's multidimensional, the way that we need to do it. And so looking at the role that we can...
I'm sorry, Lynette. Hello? It sounds... Yes, I'm sorry. It sounds like you're breaking up. Perhaps maybe use the chat area to write your comments, and I'm going to move on to the last question given the time we're in. I'm quite sorry. It seems like you're coming in and out too much. We can't really follow your thought, but feel free to type it in the chat box below. Quite, my apologies for this. So let's just move quickly to this last question as, from Mihaela of the International Step-by-Step Association. And she says, to what extent the panelists have knowledge about programs and approaches that bring together professionals from different sectors in in-service training programs? The networks of support are crucial, as Hiro mentioned, but to what extent do these networks include different professionals across different sectors? And Lynette, feel free to try again. I don't mean to exclude you.
I can speak a little bit to our experience in the country of Chile, because our the effort was within the context of the delivery platform of early childhood education, but a core piece of the program was connection to the healthcare system for families of young children, and in particular to address some of the major health problems nationally for that age range. And so absolutely, the health professionals, the community health workers were involved in these networks. So a continuous quality improvement kind of approach to networks is extremely flexible and can foster this kind of intersectoral contact. And I believe a U.S. example applying this approach to home visiting has also brought together staff from multiple sectors. I think there is also a unique opportunity, building on, I think, Lynette's last point, and this childcare issue, with networks to try to bring together, let's say in a particular geographic area, both public and private providers, to set common goals around what quality improvement might look like in their services. So I think often we're in a situation where a single sector might be a host, so to speak, as far as a delivery platform, whether it's social protection or education or health. But this network approach to building support for professional development should always pay attention to bringing in staff from other sectors, not just the primary platform.
Thank you. Does anybody else want to address this? Lydia, Lynette, try again. Morgana?
Just to add on to what Hiro's just said, totally agree with what he's been saying, but I think it is absolutely right, because we need to go for this multi-sectorial approach as well, because his health, I think, is very, very critical, and so child rights, because there is a movement now, because there's NGOs who are looking into this, and I think this is also a very critical aspect of early childhood education, or ECD or ECCE. So I think these are things that we are now looking at in this particular project that I just had mentioned earlier, that we have mounted. It's a nationwide project that's mounted by one of the national universities. And all these multi-sectorial approaches are also being looked into, so that we are going for a more holistic approach to early childhood education and early childhood care. Thank you.
Given that we're 15 minutes over our time, so we're starting to, I think we should start to wrap up. Unless anybody has any other questions, I'll give you a few more moments for participating. Well, on that note, then I guess the silence means that everybody's ready to wrap up for today. And I wanted to thank all of our presentations for all of the very interesting examples that you have provided, and given the time, I won't wrap up everybody's points, but I think that something we have heard today is about how there's a need for advocacy from the community level all the way up to government in order to bring together the profession of the ECD workforce. There is a need to improve its value in the community for young children, and also to improve the conditions of work for children. As a result, I think there's different approaches that Hiro has mentioned as well to supporting the workforce of people working with young children. He's given us several examples in Chile and also in other countries that we've heard today. Lynette's provided some examples in Namibia, and the examples in Malaysia also show how it's important to have information as to what are the issues within a country and what these implications are for future policies, and how to actually decide what are the priorities within different countries. So with that, I'd like to wrap up for today, and please remember this event was recorded and it will be shared online. We'll be continuing this conversation also via Facebook, and we can have this continued exchange on that platform for the next several weeks. We'd also like to take this opportunity to thank all the panelists today, and to let you know again that there is going to be a second panel tomorrow on Wednesday with a different set of speakers starting at 5 p.m. Netherlands time. And please do sign up to join in tomorrow as well if you're able to. I'm going to show, I'm trying to figure this out, I'm going to show the screen of the link to how you can get to the platform today. Sorry, I'm seeing that it's, hopefully you're seeing my screen. And it's showing you the link. I'll read it out loud. It's www.earlychildhoodworkforce.org, and the node number is 50, node/50. And I want to thank you everyone for your participation, and we look forward to hearing more from you via the Facebook event page. Thank you very much.
Thank you very much.
Thank you very much.
Thank you.
Thank you.
Thank you, and we'll stop recording now. Thank you all for your participation. I look forward to hearing from you again.